Today we're going to be talking about Guillain-Barré Syndrome, otherwise known as GBS. Guillain-Barré Syndrome is an immune-mediated syndrome that typically occurs after a respiratory or gastrointestinal viral or bacterial infection. When
we get sick, our bodies produce antibodies to fight the sickness. In Guillain-Barré Syndrome, antibodies in our body mistakes neurons to be a substance that should be attacked.
what happens is it will go directly on to the important parts of your nerves and damage them. To understand this more clearly, let's talk about your nervous system. Inside your body, you have two nervous systems. There's the central nervous system, which is your brain and spinal cord. And then you have the peripheral nervous system, which is all the other nerves outside the rest of your body. And within those nervous systems, there's neurons. And there's over 1 million neurons inside of your body, and they're all communicating with each other, working as a team to send messages to and from your brain. So in a neuron, we have a cell body, dendrites, an axon, and this coat is called a myelin sheath. And then the axon and myelin sheath continue down, and then you have some axon terminals. And what happens in your body is we have all these connections. So another neuron will come and attach to the other side of the neuron, and all of these will send messages to and from the brain. So in Guillain-Barré Syndrome, your peripheral nerves, the nerves outside of your brain and spinal cord, become attacked. Two kinds of neurons. First, you have sensory neurons, and then you have motor neurons. So sensory neurons pick up a stimulus from outside the environment, and they'll have a chemical message go up towards the sensory cortex in your brain. Once the brain processes that message, it'll form a new message from the motor cortex and bring it down your brain, or down your motor neurons to stimulate a response. In Guillain-Barré Syndrome, symptoms normally start in a person's toes and hands. They'll experience numbness and tingling that will go all the way up their body, and it'll eventually result in difficulty breathing, loss of reflexes, paralysis, and all of these signs and symptoms are typically symmetrical within the body.
Signs and symptoms of Guillain-Barré Syndrome can occur within hours and usually reach their worst within 2 to 4 weeks.
There's 2 cases out of 100,000 people per year that get Guillain-Barré Syndrome. Anyone is susceptible to it. However, there's higher cases in older populations, males, and the lower cases in children. When a person is experiencing Guillain-Barré Syndrome, it's typically a medical emergency and they need to go to the hospital. Once they're at the hospital, it is common to have a plasma exchange.
Patients also might have IVIG, which has equivalent benefits to a plasma exchange. In either of these cases, the goal of treatment is to speed recovery and reduce the amount of symptoms that are caused by Guillain-Barré Syndrome.
Once patients are stable, typically around 2 to 4 weeks after experiencing symptoms, it's time for rehabilitation. So, patients will go to the rehabilitation ward and they'll start to increase their strength and learn how to walk again and retrain their sensory patterns. Unfortunately, 20% of patients do not fully recover and can remain paralyzed after having Guillain-Barré Syndrome. It's also common for some people to still experience pain and weakness and tiredness after recovering from Guillain-Barré Syndrome. Most patients recover after 24 months, and sadly, 5 to 10% of patients die from Guillain-Barré Syndrome. There are 4 subtypes of Guillain-Barré Syndrome. The first subtype is acute inflammatory demyelinating polyradicular neuropathy, also known as RADP. The second subtype is acute motor axonal neuropathy, known as AMAN. The third subtype is acute motor and sensory axonal neuropathy, known as AMSAN. And lastly, there's Miller-Fisher syndrome, otherwise known as MFS. These different subtypes seem to occur in different quantities throughout different parts of the world. AIDP is the most common type of GBS. It attacks the myelin
in the neuron,
which slows down or blocks the communication between neurons in a person's body. Remember when we talked about the motor neurons in your body? Acute motor axonal neuropathy attacks the motor neurons in a person's nervous system. So the axon on the motor neurons become damaged.
An individual with a MAN will still have sensory receptors, so they'll be able to feel pressure and temperature. However, if their brain is trying to send a message to create a movement, the message will not be delivered.
AMSAN attacks the sensory and motor neurons in a person's body. So this causes a block between the messages that are going to the brain and the messages trying to come from the brain. Patients will lose proprioception, they'll experience areflexia, abnormal or absent reflexes, and they will have sensory and motor loss symptoms. Underneath your brain, you have 12 pairs of cranial nerves that control the sensation and actions of things that happen in your face.
In Miller-Fisher syndrome, the cranial nerves are affected. Patients will experience eye muscle weakness or paralysis, ataxia, areflexia, and loss or reduced reflexes.
There was a lot of talk about flu vaccines causing GBS. In 1976, there was a national influenza program that provided adults with influenza immunizations. During that time, there was a significant increase in the cases of GBS.
Instead of the typical 1 to 2 cases per 100,000, the cases went up from 4.9 to 5.9 million cases per year.
The national influenza program was suspended. After that, there was more studies done on the correlation between vaccines and GBS. It was found that there's no significant correlation between an increase in GBS cases due to a vaccine. This is because influenza can cause GBS, so it's unfair to say that the flu vaccine is increasing the chances of GBS. I hope that you learned something new about Guillain-Barré Syndrome today. Thanks for watching and have a great day.